This month is about focusing on our cardiovascular health. Currently, heart failure is a very serious condition that has no cure. However, treatments such as healthy lifestyle changes, medicines, and some devices and procedures can actually help many people have a higher quality of life. We spoke with Dr. Wagner at Mercy Health for more insight on heart failure.
My name is Lynn Wagner. I'm a cardiologist here at Mercy. My background is mostly in heart failure. I did special training during my cardiology training to be a heart failure specialist. So I have a special advanced degree in heart failure and transplant. I've been in Cincinnati since 1994, started at the University of Cincinnati, where I was involved with the heart transplant program for 13 years, and then I moved up here in the community with Mercy since 2007, and now my practice is mostly with managing heart failure patients and many of the diseases that are linked to heart failure. Heart failure is a condition that is kind of the end stages of many heart diseases. It defines largely the symptoms of shortness of breath, fatigue, as well as swelling that can occur when the heart muscle doesn't work very well. So the heart, as we can see from this model, is basically a muscle. And if I take this off, you can see that the muscle of the heart, this is the left ventricle, the main pumping chamber of the heart. This muscle can become diseased by a lot of different diseases, and either the heart muscle becomes weak or it can become stiff so that it doesn't pump efficiently as it used to. And as an end result, the heart ends up backing up fluid into the lungs, and the patient will become short of breath, they'll have swelling, and will not feel as good, be very fatigued and tired. There are a lot of conditions that can lead to heart failure. The main one is coronary artery disease, or blockages of the heart arteries. Patients that have blocked arteries can have heart attacks and heart damage to the muscle, and that weakens the heart muscle so that it doesn't squeeze as efficiently. The other condition that is very detrimental to the heart is high blood pressure or hypertension. And what happens with high blood pressure is it overworks the muscle. And so because the muscle's like any other muscle in the body, it gets bigger if you work it, but a bigger, thicker muscle is not very good. And what happens with time is the heart muscle says, okay, I'm not going to work under these conditions. It starts to get enlarged and kind of poops out, and in that case the patient will develop heart failure. Diabetes can also contribute to heart failure. Obesity can contribute. Sleep apnea also contributes to heart failure. So there are a lot of different everyday diseases that, especially when they're combined, can lead to heart failure. A number of tests are usually done when a patient comes in with shortness of breath. Obviously, shortness of breath is usually the most common symptom. And of course, shortness of breath can be either be heart-related or lung-related. And so what you have to do in the beginning is try to separate the two. Blood work can be done to look and see if there are certain markers that are elevated that indicate that the patient's holding extra water. Also, usually the first test is an echocardiogram, which is an ultrasound of the heart. It's a non-invasive test. They put goo on your chest, take pictures of the heart, look at the heart muscle, see how the heart muscle is functioning, if it's squeezing okay. It looks at the heart valves as well. Many times if you look up heart failure, you will see statistics such as patients would have a 50% 5-year survival rate once they're diagnosed with heart failure. I think with the therapies that we have out there now, we've improved that statistic, and I think patients are living longer with heart failure once they're on these different medications that will improve either the ejection fraction or keep them decongested and keep them from having as much fluid. Things that can help, that a patient can do to improve their outcome would be to monitor their own weights and blood pressures and pulses, sort of take over their own care in terms of monitoring themselves to see how they're doing. Many times a patient will gain 10 to 15 pounds over several weeks and not notice that they're doing it. And of course that's fluid over that period of time. That can lead to a hospital admission where a patient will have to be admitted because their oxygen levels are low. They have to be diuresed to get rid of the fluid. And those patients who are getting admitted with those fluid overload episodes are at a higher risk of dying within the next year. The number one thing that has to be done when a patient comes in with heart failure is to reduce the amount of congestion or the fluid that is probably causing their symptoms. So the main treatment to start with is usually a diuretic, a medicine called furosemide and other drugs that will get rid of water to reduce the swelling and help them breathe better. There are newer agents out there now that have really changed how we treat heart failure and have really made a big difference in how patients feel and the longevity, how long patients will live with heart failure. Usually there's a variety of medicines that we use. We try to tailor those meds to the patient. These medicines can lower blood pressure, get rid of fluid, slow down heart rate. So many times it's you look at each patient individually and adjust medicines in sort of a slow, methodical way over a few months to try to tailor them to the patient to get them to the point where they feel better, breathe better, and are not continually building up fluid.